One of the areas that are gaining a lot of attention recently is that connection between weight loss surgery and eating disorders. Studies are showing an increased number of post bariatric patients presenting with clinical eating disorder symptoms and requiring specialized treatment. When left untreated, post surgical eating disorders can result in weight gain, medical problems, and added healthcare costs. You don't want that, do you? Surgery is just one tool. It's time to put the other tools in the toolbox because it's your body, your health, your life. Let's talk about some common myths and dig a little deeper in those red flags regarding disordered eating and eating disorders. Adjusting to post op dietary restrictions is very difficult, especially for us, those who struggle with disordered eating or starting to become concerned about disordered eating and those problematic eating behaviors. So feel free to pause on the first video, catch up, jump back in, and let's dig a little deeper. I'm hoping and assuming that you're committed to finding out a little bit more about disordered eating, figuring it out, especially after having weight loss surgery. You have the potential to make big changes for the good in your weight loss surgery journey, as well as your self worth, your self confidence, and your relationship with food. So I'm super glad that you're here. Seriously, pat yourself on the back. This is not an easy topic. As we talked about in video one, disordered eating is different than a clinical diagnosable eating disorder. That disordered eating is on a continuum. And remember, I need to remind you that disordered eating, depending on that intensity, depending on how many behaviors that you experience and how extreme they are, disordered eating is the greatest predictor of developing a diagnosable eating disorder. Just an important reminder, it is worth noting here that disordered eating and eating disorders comes in every size of body, weight, gender. And with this in mind, you need to really check your own biases. For example, have you or a loved one in the past, or maybe even now in the present, do you celebrate or judge certain behaviors in certain sizes? Do we allow certain behaviors to happen in smaller bodies than we do in larger bodies? It's really important, lastly, to remember that even health and fitness gurus, nutritionists, and even bariatric surgeons are suffering with disordered eating. We're all wondering if some of our eating behaviors, our food habits, fall into one of these categories. Obsession with weight control. It is natural, especially after having weight loss surgery, to want to know about and see what is happening with your weight. It's the reason we had surgery, right? It's when it becomes an obsession where the intensity is so extreme that all you're doing is living to weigh yourself on that scale. You're obsessed with the number on that scale, and it starts to affect your mood. It starts to affect how you interact with others. It's everything you think about. Are you obsessed with reaching a certain goal weight or a certain weight? You can't do something without moving forward before you reach that weight. You start to beat yourself up, or you think badly about yourself if you haven't lost a certain number of pounds in a certain time frame. You experience extreme reactions to your weight fluctuations. For example, what is your mood when you gain a little weight, and what is your mood when you lose weight? You're starting to create real strict guidelines about eating, especially to the number on your scale that day. You feel like you have to get to the gym every day. You have to work out every day. You have to exercise every single day. And you get super stressed if you miss a workout or you can't follow that pattern consistently. You resist rest days out of fear that you're going to gain weight. You can't acknowledge other interests outside of working out or obsessing about your weight. You're starting to lose touch with other parts of your life. You push yourself to do more, especially about exercise, than what is recommended to you. You're just married to the scale, like literally married to the scale. Your mood, your self worth, the decisions you do really depend on what you see on that scale. compensating for calories consumed or missed workouts. You use exercise or movement as a form of punishment for food consumed, or you kind of fall into that behavior of, I have to work out so much. You have to earn so many points, exercise points or movement points before you can eat a certain food. You have to go extra hard to make up for what you consider a binge the night before, the day before, the hour before. Or you have something coming up and you excessively exercise to prepare to allow you to attend that event or consume that amount of calories. Example, prolonged fasting, extreme fasting, excessive exercise, induced vomiting to get rid of calories, taking diuretics, laxatives, even diet pills to release weight, participating in extreme, extensive cleanses, prolonged or consistent repouches, or going back to the liquid stage phase, or even that chew and spit behavior. Chronic dieting and caloric restriction. So let's remember our dieting history can give us a really good insight into our present day relationship with food. Were you a person that jumped from one quick fix diet to the other? Were you a yo-yo dieter? Did you do all of those kinds of things more than maintaining a steady weight? I know I did. I did it for years. And that was a sign back then, even, that I was participating in disorder eating behaviors. Let's remember that behaviors like extreme cleanses, severely restricting calories, extreme fasting, even using food replacement supplements to curb hunger was super normalized by the media, the diet industry, and even mainstream culture. Even within the fitness and gym culture, they are actually signs of disordered eating. How many of us would make certain foods like a villain, calling them bad or off limits, like obsessing about even nutrient dense foods, low calorie foods, so that we can save calories or restrict calories? Or we get wrapped up in even things that the media or society is telling us, food industry is telling us, is superfoods or miracle foods. These are kind of all things that we were shown, we were role modeled, we were subject to constantly. So just thinking ahead for the next red flag, feeling out of control around food, including intense feelings of shame around eating behaviors. Are you caught up in a cycle of binge, restrict, binge, repeat, where you kind of find yourself going all out, consuming large amounts of food again, and then just feeling extreme shame and guilt, and severely restricting how you eat the next day, or maybe even how you approach your movement or workout regime? And you do this again to the point where you can't stand it anymore, and you repeat the cycle all over again. All these things, if this is becoming your pattern, this should alert you that you are struggling with disordered eating. Are you finding yourself engaging more and more in binging episodes, which is described as consuming a large amount of calories or large amount of food in a shorter period of time, and is usually followed by intense feelings of shame, guilt, judgment, all of the above? And binge eating disorder behaviors quickly can increase to a diagnosable eating disorder. You are hiding food wrappers, food containers. You're eating in fear of anyone watching you again. You're eating in places that other people can't see you. You don't want anyone else to know how much or what you're eating, including yourself. As we discussed in the last video, disordered eating is placed on a spectrum. So you have the normal eating behaviors, and then you have way on the other side of that continuum spectrum is the diagnosable eating disorder. Here are the definitions of the diagnosed eating disorders. Feel free to pause the video, write this down if you need to. You can always save the video and return to it later. think about eating disorders, we kind of have these stereotypical images in our head. It's usually images of very young white women, very thin, either hunched over a toilet or looking in a mirror in extreme misery. This image comes up again and again. I even like challenge you to Google it right now and see what you see. Yet this misrepresentation does not give you the true picture of what eating disorders are. We all have to take into consideration particular challenges, life experiences, our own narratives, society conditioning, and just the way we respond to sensitive issues, which includes disordered eating and eating disorders. With that in mind, it's important to understand the truth about eating disorders and disordered eating and how that may affect you. Let's do that right now. Let's bust through some of these common myths. You can tell if someone has an eating disorder by just looking at them. It's impossible to assess someone's social, mental, physical, behavioral health by just looking at them, by their appearance, by the number on the scale, by a category on the BMI chart. Relying on your appearance or that number on the scale to assess your health perpetuates a harmful myth and keeps you from getting the help that you need. Only young, thin, white women suffer from an eating disorder. Disordered eating and eating disorders affect all people, all sizes, all weights, all ethnicities, sexual orientation, nationality, socioeconomic status, all of it. The thing is, due to a limited representation, a real representation from about eating disorders and or disordered eating, it really makes it hard to identify with some of these messages regarding disordered eating and for people to get true help. Most portrayals of eating disorders, for example, especially in movies, is usually anorexia nervosa. But people with anorexia nervosa, as well as bulimia and binge eating disorder, is not truly represented, which the truth is comes and displays in all sizes. Eating disorders are a choice. Eating disorders are complex medical situations. It's not lifestyle choices that can easily be stopped by an individual by one decision. Diagnosable eating disorders are biopsychosocial, which means they have several elements in play, including genetic components, biological components, environmental elements, and societal elements. Bariatric surgery itself causes eating disorders. Bariatric surgery, as we know, are often recommended by our medical professionals to us who struggle with obesity. Well, obesity is not the same as an eating disorder. There kind of is an intersection between the two. A sizable number of people who do undergo bariatric surgery, weight loss surgery, have an eating disorder. An existing eating disorder can make bariatric surgery worse. Unfortunately, and I think we know this is true, that researchers have found that disordered eating, eating disorders, those problematic eating behaviors are just minimized and underreported before having surgery because of the fear that surgery would not be approved. And some of us are just, we know this, so we fear to admit to some of these problematic eating behaviors even before having surgery. Furthermore, the surgery does present some of these side effects or complications post-surgery that may mimic eating disorders, but surgery in itself does not cause an eating disorder. Eating disorders are not serious. In addition to medical complications from binge eating, starvation, purging, even overexercising can lead to other health consequences such as heart attacks, kidney failure, osteoporosis, and even like electrolyte imbalance, which just kind of leads into more and more serious consequences and impacts your quality of life. Unfortunately, myself included, you may not believe that this disordered eating behaviors, this disordered eating situations are problematic because we just are used to it being normalized in media and movies. It happens in our fitness sphere and gym cultures. So, as a result, many individuals, ourselves included, we get positive reinforcement for these kinds of results, not only by our family and friends, but also from our medical professionals, even including our bariatric surgeons. Are there ways to reduce or prevent the risk of getting an eating disorder? Click on the link or touch the screen now. I'll see you there.